hopefully you can be around for the Q&A. Okay, so hopefully, Sarwar, you're sort of lurking amidst the kind of people who we've got here. Here we go. Welcome, Sarwar. He's a great supporter of the SOM. Has helped a number of things from sort of revision to DOT Med revision. So, great supporter of occupational medicine generally. Thanks, Sarwar, for everything you do. It's very much appreciated and noted. And over to you.
Okay, great, excellent. So hi, I'm Sarwar. I'm an occupational health physician. Gareth, who just spoke, is my medical director, so I work at Medigold. And I just wanted to kind of run through my career to date and the reasons why I think everybody should be considering occupational medicine as a career. It's certainly something that I've been involved in just over a year since Gareth interviewed me and I got a role, and it's something that I believe that I'm going to be doing for the rest of my life, and I'm definitely someone to advocate and to make people aware of that. So I'm aware that we're obviously short for time, so these are just some of the things I wanted to run through. The idea obviously is that I'm just going to focus more about my career, as I know that Gareth's run through Medigold, and I'm sure that Ali's run through all the other kind of training routes, etc. And Nikki, who's going after me, will hopefully highlight some of that as well. So how did I get here? So I did med school. I graduated from Barts, did a couple of years of foundation. Much like a lot of the doctors, I didn't really know what I wanted to do. So I did a couple of years of locuming. In that time, managed to kind of locum in surgery, medicine, just trying to find my place in the medical world. Like a lot of people were thinking about GP, so I got a training post in GP, but I felt that was kind of more of a scapegoat, and I was wondering what else is out there, and then started to kind of look outside the box and look for other things. In my second year of locuming, I discovered disability assessments, work capability assessments, so the CHDA that Gareth mentioned, and I joined them. Within a couple of months, I realised that actually I felt that GP probably wasn't right for me, and I kind of started working in the corporate world and found that was something that I wanted to do. In particular, disability assessments deals with kind of legislation, report writing, non-treating role, corporate environment, and these are the kind of things that I felt that were more suited to me. I then did the diploma of occupational medicine off my own back. That's it behind me, just behind me there on the wall. I did that in 2018, and then soon after that, I felt that the kind of CHDA role and functional assessor role that I was doing was like the stepping stone towards occupational medicine. And here I am a year later, and I'm very happy in what I'm doing. So I'm not going to go into a lot of detail. Ali's run through a lot of this. The main thing that I wanted to highlight that it isn't just medicine. You've got a lot of ethical stuff that we deal with, and law as well. So there's like a perfect blend of those three things. The idea is that you are kind of the bridge between the employee, the employer, GPs, specialist treating physicians, and it's kind of like a holistic kind of involvement that you have. And in the top right there, I've just highlighted some of the legislation that we would be dealing with. Again, I'm not going to go into so much detail, but these are the kind of things that people can do as an occupational health physician, and something that I do very regularly. It's very variable. There's lots of different things that you can get involved with. It really depends on what you're interested with. No 2 days are the same, and it's something that I found is very attractive from a career perspective. Again, I won't go into a lot of details because I know Ali's gone through a lot of this, but you know, I think most people's experience of occupational medicine is probably like a half a day lecture in medical school, and maybe just probably like the vaccine status before starting your role and travel medicine, but occupational medicine is quite a lot more than that. It's a subsection of the Royal College of Physicians, and it's got its own faculty, the Faculty of Occupational Medicine. You have the training routes, as Ali's gone through, and the non-training route, which is what I'm involved in. And essentially, there's lots of different levels that you can be. You can either be a generalist or more of a specialist, depending on what your level and what your career appetite's like. So again, I'm not going to go into too much detail because Ali's gone through it, so please do ask questions for Ali if you have any questions regarding this. The idea being that the training route is kind of a more direct and more supported route, but at the same time, you know, you would have to go through interviews, etc., to get to that level, and eventually the end game is to become a consultant and become an accredited specialist in occupational medicine. The non-training route is what I'm involved in, and that's something that I'll be talking about in a bit more detail. It's something that is relatively unknown but becoming more popular. The idea being is that it creates a bit more flexibility. A lot of doctors may just decide that they want to be a diploma and be a generalist and not go any further, particularly those that may have already got CCT, particularly in things like GP, and they don't want to do a lot more. But then there are some that obviously want to continue, and there is that flexibility, particularly if you want to go down the CSER route, which is another way to demonstrate your experience and your skills that you would have gained in otherwise in CCT training, and then you can, if successful, the GMC and the FOM can review your evidence and get you to that MFOM status if you are successful. So I think this is probably more what people want to ask about. This is something that a lot of people may not understand unless they do shielding or they speak to someone specifically that in occupational medicine. And this is my particular day, so I must make people aware that that there are different companies that do structure the day differently. But I think most companies do similar type of thing. It's a very kind of 9 to 5 type of role. I normally get in about half an hour before. I go through 4 appointments, which are about 45 minutes each. This allows me to kind of read the referrals from the management, take a history and do the assessment with the individual over the phone or in person, and then have some time to write up the reports and then kind of move on to the next one. So it's enough time to kind of complete everything. I normally get an hour admin time, which allows me to prepare for the afternoon as well. And then with our role at Medigold, we get an admin time after the afternoon session, which is quite useful, I think, for a lot of people who might have other commitments and may wish to complete their reports later on. I myself like to get everything done before I'm done and I'm going home. So that's what I often use it for. There is some home working, and I think this is something that Gareth alluded to. More and more companies are going this way, particularly with the coronavirus restrictions, and there are site visits as well. So I did a visit to the WH Smith headquarters, for example, and this is something that I don't do very often, but there are some roles for that. No weekends, which I know is very attractive to a lot of people, and on the right there's a load of things that could potentially be what an occupational health physician gets involved with. I thought I'd just show you this because this is something that I get asked a lot when people contacted me, which is does a report look like, how much detail do you need to go into, what the kind of things are you writing. This is my particular report that I use. Okay, I know some clinicians prefer to dictate with a dictaphone. Some people type up. I myself use Dragon dictation software. I'll have a rough kind of template and then I'll go through it all and make sure I fill it out. The main thing about this that I wanted to just highlight is that you are still a doctor, you do still take histories, you do still examine, you do need to use your medical knowledge every day, and you combine that perfectly with the law and the ethics side, and you would look to try and give an opinion or an outcome. Anything obviously that you feel is concerning, you do have the ability to write to GPs with the employee's consent, of course, and you can highlight those things, and this is something that I do, as well as if you wanted more information like scan reports and any opinion from the specialist. This is also something that an occupational health physician can do. And then the other emphasis that I wanted to just make is that, remember, we're in an advisory role, a non-treatment role. Our job is to advise, and it's largely up to the employee and the employer to decide and discuss a lot of things, and that's something that should be highlighted in most reports. What do I plan to do from now on? So I'm going to go and I'm looking to do, so I'm actually doing pension training next week with ill health retirement. I was also looking to do HABs as well, but it's something that I'll put a pin in for now because I've got a lot going on. But I'm also in my second year of my MSc from Manchester University. I think this is not necessary, but something that's very useful, particularly because I'm looking to do the MFOM Part 2 next year in June, and the kind of content for the masters is beautifully complements what you need to cover and is a good basis for that. After doing the MFOM Part 2, I'll be able to get the AFOM non-mules and become an associate specialist, which is slightly different from an accredited specialist. But my aim goal obviously is to try and go towards a consultant status, and that's something where I will look into doing CSER, which I'm undertaking right now, trying to get all that evidence together and then show the GMC again seeing it for when that I have got that appropriate experience to be given those that status at the end. Last thing, last couple of slides I want to just highlight. So these are the kind of things that I regularly tell people about occupational medicine, why I want to go into it and why it's such an attractive specialty. Again, 9 to 5 work, no nights, no weekends. Salary is very competitive depending on experience and obviously which company you work for. And there is that part-time role. The other benefits of that it's very complementary to most people's lifestyle. I liked it particularly because it was office space and corporate environment, and that's something that I personally enjoy. But there are obviously site visits, and obviously working in NHS, and you get that experience as well. I particularly like it because I felt that with GP particularly, there wasn't enough time to go into a lot of history and detail. So I found that 45 minutes to an hour is very useful for that, and this gives you a good chance to really delve in about their work, their home, their functional history, and be able to give an appropriate opinion. And lots of variety in terms of types of assessments, wide scope of medicine. So I deal with mental, physical, and weird and wonderful conditions as well. Lots of training progression, obviously depending on which occupational health specialty company you join, but the majority are very supportive, particularly Medigold I found really supportive, and one of the reasons why I joined them because they were so supportive with that, and they were very keen to get me progressed in my career. I remember delivering this last year, and I wrote no risk. Well, there is some risk obviously with every profession, but there is less so in occupational medicine because you're mainly an advisory role. You give your opinion, but obviously you need to justify that accordingly, and there are certain legislation that you need to make yourself aware of and base your opinion on. But I really enjoyed about the fact that it's a multidisciplinary team, and I think Ali's correct in the sense that this really is a truly multidisciplinary approach, and it's very useful. And I found it was very nice being the connecting point of all these different specialties to be able to give an opinion and chat to the employer directly through the report. Last thing I just wanted to highlight was wearing nice shoes and watching shoes. I mean, for me, that's something that I enjoy. I found that I wasn't able to do that in a lot of the roles that I was doing in my locum job, but it's something that I particularly enjoy being in that corporate environment. I'm going to put a few of the cons, there's very few, but these are the kind of things that, and particularly I found when I switched over to occupational medicine and particularly into the private sector. Not everybody knows what you do, so it's a job of explaining that. You are in that non-treatment role, so you might lose some of that benefits and that feeling of being able to see if some treatment works, and I haven't really prescribed in the last few years, which is something that I do miss sometimes. There is some stigma obviously choosing a non-NHS role. But I think the other thing is obviously that often you are like the one-stop shop, your opinion. You only see what a person wants, but you spend a lot of time with them. You give your opinion, but often you may not see that again. And I think that's something that people should bear in mind. But the pros outweigh the cons. I don't know if I've got enough time for this, but this was something that Nick Paul asked me to put in because coronavirus is obviously a very common topic at the moment. The role of occupational medicine is actually, I think, under stated, and there's lots of things that we do in occupational health. A lot of what I'm doing right now is advising regarding health and work, regarding the coronavirus, shielding guidance, and whether someone can do their role or not, and what the employer essentially needs to consider changing in order to allow that person to work safely, particularly if they've got lots of health problems or their age is very high. I'm not going to go into too much detail with this, but I think Society of Occupational Medicine is something that I joined and got involved with very early, very useful. A great way to network. Occupational medicine is a relatively small specialty, and I found this was a great way to try to meet people and get involved. This is something I just wanted to finish with. So we recently ran a course for the Diploma of Occupational Medicine. It's a supplementary course, something that I found difficult, and those who are looking to get the diploma might wish to look at this after they've done the compulsory course. It's just a couple of days course that we ran just to give you a little bit of nuggets of information and give you more of an awareness of what to expect, especially because a lot of people that sit this exam unfortunately don't have a lot of occupational health experience. So I found that this was just something that I felt there was a need for, and I ran recently, and it was quite successful. So I'll leave the questions for later. These are my details. I'm on Instagram as well as LinkedIn, so feel free to contact me. And Society of Occupational Medicine have an email, so please do contact them and they can put me in touch if it's something that I can help with. Thank you for listening.
Thanks very much, Sarwar. Really good presentation, and you're such a great advocate for occupational medicine, why people should move into it. It's you know, it's a very satisfying career, but you've been honest too in terms of, you know, it's not for everyone, but I think most people when they realise what it is and you know, how enjoyable it is, they do realise they made the right choice. So I'm going to hand over now to Nikki Cordell, who's extraordinary, being able to both do your PhD, sort of grow an excellent community interest company, also contributes to events like this, and her e-learning has helped set up our kind of e-learning 2-3 years ago. So huge supporter of the SOM, but also the profession generally. So I'm very lucky to have you here, Nikki, and over to you. Thank you.
Okay, thank you very much, Nick. Just a little bit of background about me. I started off like many occupational physicians in general practice. I actually moved then to the army and was trained within the military to become an occupational health practitioner. This allowed me to see an awful lot of the world, as well as training in very unusual occupational health roles, and then eventually to set up occupational health services both in the UK and in Germany. And then having married another occupational physician in the military, we discovered that we were never in the same country. And so we decided to leave one after the other and work for a number of different occupational health providers. In that time, we wanted to look at a completely different way of setting up a business, and we set up our own social enterprise 4 years ago with the mission of getting organisations to move their focus of disability of their employees to ability. And this is the forefront of everything that we do. So part of our social mission is not only to deliver occupational health services. We started off, as I say, 4 years ago, my husband, I, and a specialist occupational health nurse. We now have over 50 employees. We have 4 what we call hubs, working from Bristol, Portsmouth, Finch Hampstead, which is near Reading, and Guildford. We have a small business running in Gibraltar, and we also work out of London, Oxford, and South Wales. We are a business that not only delivers standard occupational health services, we also deliver training into businesses that are related to health and well-being. We have a number of well-being deliverables, including a series of free webinars that we give to our clients and wider. And we also have done, over the COVID period, we've done an awful lot of work for our clients and made that all available on our website to the wider UK businesses. Like many occupational health providers, we do have a lot of health surveillance. And just as we were going into lockdown, we acquired a business of the equal size of us that delivered occupational health into universities. So suddenly we had a dearth of work, but we took advantage of that in creating different services for our clients around COVID. And also for our furloughed staff, we lent them to organisations like the SOM to help with projects, to give them wider experience until the work started to come through. And what we are doing at the moment, as well as delivering to our own clients, we're on a framework to deliver to support to the NHS, where NHS occupational health providers have been very, very busy and have started to get backlogs. We are one of the organisations who are now delivering into 4 different NHS trusts. We are also very much helping the universities at the moment do all of their student screening, and now looking at what we're going to help them with, given that the university and the way they're going to teach is going to be very different for the next 12 months. We are very involved with our clients in every aspect of health and work. We provide a lot of services on site, and this gives our trainee doctors, so we have both CSER and STR trainees in the organisation. We're able to put them on site a lot and deliver on site as if it was an in-house service, as well as working from our clinical environments. And it's one of the things that our clients really like and our clinicians really enjoy. Because of I have a background in medical education, I'm very interested in developing the specialty, and also having some evidence base and conducting practical research into what people with disability need in regards to adjustments and support to keep them in work. As part of this, we've developed a number of educational resources. We are just about this month to launch our autumn programme, which is open to anybody interested in occupational health, whatever their background. It includes webinars with an experienced employment lawyer who develops a lot of the course material that we run when we run face-to-face training. And we have got a learning management system with a lot of resources for people who are wanting to develop their knowledge in occupational health. All of that is free. It doesn't compete with anybody else, and will be fully launched by the end of the year. Unfortunately, COVID has delayed some of the work on this, because we have had to do quite a lot of running around to find enough people to support the NHS work that we took on. But certainly by the end of the year, we should have a large amount of resources, which I think will be very helpful for people that are wanting to move forward for AFOM and further training within the specialty. We are also organising for next year a programme of workplace visits to some of our client base. As I said, we've got a very varied client base, which includes not only sort of local authority schools, healthcare, higher education, but also science and technology. Organisations like the Bristol Port Company, and these organisations are very willing to support the specialty and have people come on site, and for us to take groups of people round to have a look. Obviously there's a few restrictions at the moment with COVID, but we are able to arrange visits as soon as the current restrictions are lifted. And again, there will be some number restrictions, but if people want that kind of experience, because we know how difficult it can be for people just coming into the specialty to understand what it's like to be on site, to wear a hard hat and go around in your steel toe cap boots, which makes a day quite interesting. And I think what it also shows is actually the things that we get involved in functional assessments, in the practical assessments, not just in the clinic room, of what a person with an underlying health condition can do and can't do. And quite interesting working on site and doing that kind of functional assessment. Although we don't necessarily treat, I think we can make great interventions. An example, just recently, I had a gentleman who is had a psychotic episode, was on huge amounts of antipsychotic medication. We got him back to work. He was working in a safety critical role, and work noticed that he was starting to have problems with his concentration. He was starting to have Parkinson's-like symptoms, and just with liaising with GP, the psychiatrist, getting his medication changed, getting him back on site and accessing him functionally in the workplace, we've managed to retain him in work where otherwise it is likely he would have lost his job because of the safety critical nature of his work, and he was really unsafe in the workplace. It did mean that I had to suspend him medically from work for a period of a couple of months, but it has just made a huge difference to his life, and he's managed to retain him in work for a bit longer. And that just gives you an illustration of how much that we can actually have impact on people's, not only their health, but their work and other aspects of the life. And I think it's that kind of case and that kind of work that keeps me wanting to do this job, and to look at, as I say, the research and the evidence base behind it, so that we can see what occupational health of the future might look like. Work is changing. Work has massively changed now with COVID. Some of the benefits from that, people have actually realised that a lot of people objected to their employees working from home. They've now discovered that sometimes it's not that bad. And I think moving forward, we have to really look about what is going to be the next steps. You know, what is going to be the future of work, and therefore what is going to be the future of workplace health. As with all the others, I am more than happy to answer questions in the question and answer session.